Food allergies are increasingly recognized, but we also think they are more common now than they used to be many years ago. The reason for that increase is not known, but one of the concerns might be the way that we are feeding our children nowadays may actually encourage the development of food allergies. We have been increasingly strict about recommending no foods be introduced early in life, and that may actually increase the risk of allergies. So that's now being actively studied. Well, a food allergy is actually somewhat difficult to define for some people. Food allergy is related to having an allergic reaction to proteins within the food. So that's very different than having a bad reaction when you eat that food. A true food allergy means that you have sensitization to that food protein. And what we mean by sensitization is that you have allergy antibodies that are directed to those food proteins. So a good example would be cow's milk. That's a common food allergen. And people, young children, are often sensitized to that and can have food reactions related to it because of making allergy antibodies against the food proteins in the cow's milk. A lot of people will complain of side effects when consuming a certain food, which are not a true allergy. There was one survey where parents were asked if their children had food allergies, and about 1/3 of them said yes. The true incidence of an allergy is somewhat around 5 to 10% in early infancy and goes down with time. So obviously many of these children do not have true food allergies. In an allergy, you would have to have allergy antibodies directed against the protein in that food. And when the food is eaten, the person can have a variety of reactions, including cramping of the stomach, diarrhea, nausea, hives, wheezing, even in severe cases, a low blood pressure or shock. So that's a true food allergy. An intolerance can cause reactions based on what kind of intolerance it is. One common example is a lot of people see me complaining of milk intolerance, and they're really lactose intolerant, and that means they don't have the enzyme to break down the sugar in milk, and they have diarrhea or bloating from the milk. But they're not truly allergic in that if milk protein is found in a food, they're not going to have a reaction. Other intolerances can include other kinds of stomach upset or diarrhea. In very young children, there's a severe form of milk protein reaction that can cause severe diarrhea with rectal bleeding and even shock. It turns out that's not a true allergy in the sense of a skin test positive reaction. Fortunately, that goes away often with removing milk from the diet, and milk can later be tolerated when the children are older. Well, I think the most obvious thing to look for would be to look at the child's behavior and their skin, because those are things that are easy to see. So a child who's having an allergic reaction might have a sudden onset of vomiting or be unconsolable due to belly pain or cramping. They might appear pale, and they might develop hives on the skin, which are red, raised, itchy blotches on the skin. Celiac disease is a different kind of food reaction. It is an antibody against components of wheat and oats and barley called gluten, and the antibody is called immunoglobulin A, which is different than the allergy antibody called immunoglobulin E. This tends to cause swelling of the small intestine as the body reacts against the gluten protein, and patients will get weight loss or diarrhea. Because they have trouble absorbing iron, they sometimes develop anemia. Gluten disease, or celiac disease as it's called by some, is a relatively rare disorder. I do see more and more patients who come to me complaining and concerned about gluten reactions. The vast majority of them are not allergic to gluten. Some people say they feel better when avoiding gluten-containing foods, and I think that's probably because they're avoiding a lot of carbohydrates or highly processed foods, and that's probably a healthier way to eat.